On this Monday night, no longer in it together. The Atlantic bubble breaks as two provinces put up new COVID-19 barriers.
The situation has changed.
Alberta's situation increasingly precarious.
We must take action.
And Ontario breaks another record and gets a warning.
Now is not the time for pandemonium Black Friday shopping scenes.
Are big box stores getting an unfair advantage?
I have not seen an anti-small business measure like this.
Plus, a new tool to assess your COVID-19 risk. And words to live by in 2020. Oxford Dictionary's Words of the Year. Why they couldn't settle on just one.
Global National with Donna Friesen.
Good evening and thanks for joining us. There is lots to get to on this Monday, much of it related to the soaring second wave of COVID-19. The news starts in Atlantic Canada, where the bubble that's protected people for weeks has burst. Newfoundland and Labrador and PEI have pulled out because case numbers are rising. We'll get to that in just a moment, but first the big picture across Canada. Case numbers are up everywhere. Records were set again today in Ontario. Nearly 1,600 new cases and 19 deaths. And in Alberta, where more than 1,500 new cases were reported and 5 new deaths. And in Manitoba, 543 new cases there and 7 more deaths. Based on yesterday's numbers, Manitoba still has the highest rate of active cases per capita, followed by Nunavut and then Alberta. Manitoba's test positivity rate is 14%. Hospitals are nearly at capacity. 96 of 103 ICU beds are in use now. More than half of them are active COVID-19 cases. More than 900 elective and non-urgent surgeries in Manitoba have been cancelled in the last month.
We have COVID patients admitted in the pediatrics unit, in the obstetrics units, and in the mental health units. And I share this information in order to reinforce the reality that we are all susceptible to this virus.
The virus has spread so widely in Manitoba, it's now estimated 1 in every 100 people has had it. Strict public health restrictions are in place there, and the RCMP are investigating whether some churches broke those rules this weekend. And in Ontario, two of that province's largest regions, Toronto and Peel, entered a 4-week lockdown today. The new restrictions mean all non-essential businesses have to close, but many big box stores which sell groceries and have pharmacies can stay open. Smaller businesses say the rules make no sense. Eric Sorensen has our top story tonight.
Toronto's The Granite Brewery was ready to make the best of it. Spent thousands on heaters for their big outdoor patio, and then the rug was pulled out. A lockdown till almost Christmas.
Disappointed, to say the least. I don't say we're a scapegoat, but I think let's just say we're an easy target for people that are trying to appear like they're doing something.
Restaurants aren't alone. Other small businesses, such as florists and clothing stores, feel they're being targeted unfairly, since big box stores are open and are selling more than just essential goods.
To shut down small businesses that serve a handful of customers in an entire day, while allowing those same products to be sold at Costco and Walmart, makes no sense at all.
Ontario's premier is not asking the big stores to cordon off non-essential goods. They can sell whatever they have.
After speaking to some of the big box stores, it'd be a logistical nightmare. They have essential items spread out throughout their whole store. And I know this is not fair, and that's why we put an additional $300 million in to support small businesses.
The problem for Toronto and Peel, Ontario's two largest communities have the most COVID cases, putting hospital capacity at risk. Ontario has confirmed over 4,700 cases in the last 3 days. Toronto and Peel alone account for almost 2,800. The rest of the province saw just 1,900 cases. The pandemic arithmetic, Toronto and Peel represent about 30% of Ontario's population, but have reported almost 60% of the COVID cases since Friday. So don't expect the province to rethink its 28-day shutdown for most businesses.
Unless there's a drastic change in Toronto and Peel, I don't believe those will be changed.
I'll tell you one thing, if we just ignore the health and just say, okay, let's open everything up, as sure as I'm saying here, we would be in terrible, terrible shape.
Yet another spreading event looms large, Black Friday. For some of those same big stores, a stern message from Toronto's mayor. Don't open for in-person sales of non-essential goods.
We are in the midst of a pandemic and a lockdown. Now is not the time for pandemonium Black Friday shopping scenes.
The message from mayors throughout the region: this Black Friday, shop online. Eric Sorensen, Global News, Toronto.
Ontario has appointed the former head of the Canadian military to lead what the province calls the largest vaccine rollout in a generation. Retired General Rick Hillier will chair Ontario's new COVID-19 vaccine distribution task force. He served as the chief of the defense staff and commander of the NATO-led mission in Afghanistan. Premier Doug Ford says the task force will give advice and recommendations on vaccine rollout when one is approved. The plan is to get it to the most vulnerable first, including long-term care residents and frontline healthcare workers. The envy of the nation, Atlantic Canada, is no longer virus-free, and the strict rules that kept outsiders from entering and let people inside the bubble travel freely worked for weeks. Now, Newfoundland and Labrador and Prince Edward Island have decided to shut themselves off even further. Mike Armstrong reports.
It wasn't something he wanted to do, but after a weekend watching numbers rise in neighboring provinces, the Premier of Prince Edward Island is pulling out of the Atlantic bubble.
The risk to our province from an infection standpoint has always been from the outside.
As of 12:01 a.m. Tuesday, PEI is suspending all non-essential travel. Staff will be increased at points of entry. In order to get in, travelers will be required to have a pre-approved quarantine plan. Otherwise, they'll be turned back.
I've said before that COVID-19 is knocking at our door, and in recent days, that knocking has become louder and stronger.
Thank you all for joining us here today.
Now, the same announcement from Newfoundland and Labrador. That province, too, is pulling out of the Atlantic bubble for at least 14 days.
Implementing this change for a 2-week period is an effort to avoid a full lockdown.
Now, compared to much of the rest of the country, the number of cases in Atlantic Canada is still small. But there's been enough of an increase in recent days to make people nervous. There also appears to have been in both New Brunswick and Nova Scotia community spread. It's not just cases coming in from outside. PEI and Newfoundland and Labrador say they're going to take advantage of the fact they're somewhat isolated geographically to basically cut themselves off.
We're enjoying this level of freedom and we're the envy of a lot of other places around the country. We want to keep it that way.
For now, the bubble continues in Nova Scotia and New Brunswick, but it's tightening there as well. Both are asking people to travel only if it's essential. The rule of thumb, according to New Brunswick's premier, stay at home. Mike Armstrong, Global News.
Alberta's top doctor said today that province has reached a precarious point. COVID-19 is spreading virtually unchecked.
This is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures to stop. We must take action.
Premier Jason Kenney, who has been self-isolating after being exposed himself, has been largely silent for days and ignored pleas to tighten restrictions. That might change this week. Kenney is holding a cabinet meeting this afternoon. As Heather Yourex-West reports, those on the front line say even if he finally acts now, it may be too late.
They are powerful images from Alberta's front lines, photos from the ICU. In this one, a doctor calls a family to tell them a loved one has died of COVID-19.
This is where we're all suffering. Our families don't get closure. Our nurses are the surrogates for mourning, and the physicians are carrying these things knowing that the next 10, 15, 20 patients are vying for that bed.
Dr. Darren Markland says some of his worst fears are being realized. His ICU at Edmonton's Royal Alexandra Hospital is full, and painful triage decisions are now having to be made.
Those tough decisions are actually happening as we speak. There's a lot less latitude for taking a long shot.
Alberta has seen rising case numbers for weeks now, and the actions taken so far by the province have had little impact. The numbers paint a picture. Cases began increasing soon after Thanksgiving. On October 26th, the province put a mandatory limit of 15 on social gatherings, but only in Edmonton and Calgary. The curve didn't flatten. So on November 13th, bars and restaurants were given a curfew. Organized sports ended and fitness studios closed. But more than a week later, this virus has shown no sign of slowing down.
It is probably too late to continue with light approaches. the higher this curve gets, the longer we go, the more people in the hospital, the more severe the actions will have to be in order to turn the curve around.
Last week, as cases surged across the country, Alberta's chief medical health officer was left to report numbers alone.
Every premier in the country and the prime minister spoke directly on this matter. And some, like Doug Ford or John Horgan, introduced new measures. And the premier was nowhere to be found. The health minister was nowhere to be found.
The Alberta government is expected to announce new measures Tuesday, but during question period Monday, Alberta's health minister seemed to rule out any kind of lockdown.
We'll continue to impose public health measures that are based on the evidence, that are narrow, that are targeted, that are going to minimize business disruption.
Back on the front lines, Dr. Markland has one question for the premier. What's taking so long?
I like to sit down and have a beer with him just to figure out what he's really thinking about the big picture, because this is so far away from reality that I wonder, I can't understand it.
Heather Yourex-West, Global News, Calgary.
Nunavut is nearing the end of the first week of a 2-week circuit breaker of restrictions. New cases are still emerging there. Nunavut's first COVID-19 case was November 6th. There are now 132 active cases. In the last 24 hours, 4 new infections were reported, plus dozens over the weekend. Today's count includes 3 new cases in Rankin Inlet, where 18 people have tested positive, and another person contracted COVID-19 in Whale Cove, where there are now 16 active cases. The federal government has launched its revamped rent relief program for businesses, charities, and nonprofit groups. The Canada Emergency Rent Subsidy will be paid directly to commercial tenants and property owners, unlike the previous rent support program, which relied on landlords to apply. It will cover up to 65% of rent and mortgage interest, with an extra 25% available to those hardest hit. And the program will run until at least June of 2021. The one bright spot is the promise of a vaccine, and it moves closer to reality every day. Today, the one being developed at the University of Oxford is showing promise. A trial of more than 20,000 volunteers found it highly effective at stopping symptoms of COVID-19. Interim data suggests it gives 70% protection on average and may increase to as much as 90% by tweaking the dose. Redmond Shannon explains.
We wanted a vaccine for the world, not just for high-income countries, not just...
Some of the team behind the Oxford University AstraZeneca vaccine share their good news with royalty in the most pandemic way possible on Zoom.
It's an amazing achievement, isn't it? It really is.
This latest shot in the arm to COVID-19 is the 4th late-stage trial with encouraging results. Russia's Sputnik 5 is reported to be 92% effective in protecting people from COVID-19. The Pfizer-BioNTech vaccine is said to be at least 90% effective. Moderna's protects up to 95% of people. This latest vaccine appears to be 62% effective with 2 full doses, but as high as 90% when the first shot is a half dose, averaging out at 70%. That might sound low, but none of the people who got the vaccine and still got COVID-19 were hospitalised. And this vaccine has 2 big selling points. It is considerably cheaper than Pfizer's or Moderna's, and it doesn't need to be kept as cold.
You don't need a freezer to store the vaccine. You can distribute it in the conventional way for all vaccines, keeping them in a 2 to 8 degree centigrade fridge.
That is big news in countries that lack special freezer facilities. The UK has 4 million doses ready to go, with regulatory approval possibly coming as early as next month.
The bulk of the vaccine rollout programme will be in January, February, March. And we hope that sometime after Easter, things will be able to start to get back to normal.
The Oxford vaccine makes up 20 million of Canada's 358 million COVID-19 vaccine orders.
We have built up a really robust portfolio of orders and purchases. It's going to be essential to have close collaboration between the federal government and the premiers of the provinces.
As the second wave continues across Canada and here in Europe, medical experts and politicians warn against thinking the fight is anywhere near over. Redmond Shannon, Global News, London.
COVID-19 and the climate crisis coming up, the effect of the pandemic on greenhouse gas emissions. In the U.S., the transition from the Trump administration to President-elect Joe Biden will finally begin. The administrator of the General Services Administration has formally designated Biden as the winner. That triggers federal funds and resources to begin the transition. President Trump, who has spent more than 2 weeks claiming falsely he won, tweeted today that he accepts the decision but will keep fighting the results. A delegation of NBA stars went to the Vatican today, invited by Pope Francis to talk about social justice. The Pope said he was eager to learn more about their social justice activism and talk about police brutality, plus racial and economic inequality. During the meeting, which lasted about an hour, Pope Francis commended their efforts, calling the players champions. There's a reality check tonight on greenhouse gas emissions. They are down a bit in 2020 because of reduced activity during lockdowns, but it's not enough to make a difference to the big picture. According to the World Meteorological Organization, CO2 levels, the most abundant greenhouse gas, hit record highs in 2019 and are rising in 2020. That's despite the pandemic grounding planes, docking ships, and keeping commuters home. Estimates suggest those things cut global emissions up to 7.5%, but it's just a tiny blip on the long-term graph and not enough to curb CO2 levels that are trapping heat in the atmosphere. The organization says the pandemic is not a solution to climate change, that sustained and ambitious action is required by all countries to reduce emissions to net zero. Still ahead, a new tool helps gauge the risk of visiting a loved one in the pandemic. As we've learned to live with the coronavirus, which was brand new to humans, new information has emerged and public health rules have evolved. It's not always easy to know if you're doing the right thing. Perhaps the most challenging is knowing when it's okay to visit elderly loved ones. As Abigail Beeman reports, there's a new tool to help you answer that question and determine your own risk.
I'm from Toronto. These University of Ottawa students are figuring out their holiday plans. They haven't been doing much of any visiting for a while.
We don't really. We just stay in our apartment mostly the whole entire time.
Yeah. And what made you make that decision?
Because there's a pandemic.
Visits can be really helpful for our mental health and well-being. It allows us to actually provide care and support to other people. And so this is why we don't want people to stop visiting when they can visit.
But figuring out who and how to visit can be tricky, especially with a deluge of messaging, some of it mixed and confusing.
People get infected when they are in places with other people.
I urge all islanders to keep their social circles small. We know that COVID-19 moves as we move.
The National Institute on Aging has released what it believes is the first of its kind, a personalized self-assessment tool to determine risk.
It's meant to actually help give you all the considerations that will help you understand how risky your visit could be and the things you can do to actually lower the risk of the visit.
The assessment asks 36 questions and takes about 10 minutes. How long is the visit? Indoors, masked? How will you travel there? And it asks about your health and the health of the other people involved in the visit. It's meant for people of all ages. The experts behind the tool say local guidelines take precedence.
This is a complex landscape when it comes to information. We don't want people to use this as license to break the rules.
The assessment can also help with sticky etiquette situations. When it feels rude to turn down an invite, the tool offers an evidence-based way to say no.
Not just about giving, people the freedom to go out and visit. It's also giving people the right to sort of say, look, I don't actually think it's safe.
This is a made-in-Canada tool, but those behind it hope it gets pickup globally, especially for the holidays. And for the U.S., it's been launched in time for American Thanksgiving, with much concern over travel this week. Abigail Beeman, Global News, Ottawa.
Next, Oxford Dictionary's Words of the Year, because one just isn't enough. I bet a lot of you have some choice words to describe 2020, and they wouldn't appear in most dictionaries. But the Oxford English Dictionary always does the proper thing and keeps up with the times by choosing a word of the year. Well, this year it chose a whole bunch of words. The dictionary's president said it's both unprecedented and a little ironic. In a year that left us speechless, 2020 has been filled with new words unlike any other. Mike Drolet on the words we've come to live by.
Remember the year of the selfie, or when GIFs became the way of communicating without communicating? Well, you don't have to, because the Oxford Dictionary made them the word for their respective years.
Weren't those the good old days?
I know, it was much easier back in the day to, there's one word and it was fun and like everyone was like, oh great, cool, selfie, yeah, haha, everyone takes selfies.
So what to do with 2020? And oh my, there were options. Bushfire for the Australian blazes was an early contender, but then Donald Trump's impeachment and acquittal dominated the news. And then it was March, and all we talked about was COVID-19, lockdown, and social distancing, before Black Lives Matter and cancel culture became the story, which was before we circled back to the pandemic with super spreader. So what did Oxford do? They chose all of them. And yeah, all are perfectly fine. But so too is Zoom, which is how we captured some of the more indiscreet moments of the year.
But what about like Zoom flubs?
Zoom fails.
Zoom fails.
Yeah, Zoom fails is a total thing.
Sadly, it wasn't considered, nor was Pandemic Puppy, COVID Haircut, or the awesome Tiger King star Carol Baskin, seen here as a GIF. Are any big enough to knock lockdown off the list? Honestly, no. Nor is the child. But watching him float around with actual astronauts in the space station, for a minute at least, I wasn't thinking about any of those words of the year. Mike Drolet, Global News, Toronto.
And that is Global National for this Monday. I'm Donna Friesen. We leave you tonight with this Canadian scene. Ice beginning to form on Lake Winnipeg near Arness, Manitoba. Please send us your Canada to viewers@globalnational.com. Thanks for watching. I'll see you back here tomorrow. Take care of yourselves. Bye-bye.